Good afternoon, everyone. It's really cool to listen to all these wonderful ICOs. And I feel like by the time we are finished with this conference, we would have solved every world problem with an ICO. But I'm going to try to talk about a problem that I think is very intractable and somewhat difficult to solve, and that's healthcare. Before we get started, a little bit about myself. I've been in healthcare all my life. On the administrative side, I'm the guy you love to hate. I'm the insurance executive that seemingly denies everybody care, doesn't pay the doctor, and tells you which doctor you can or cannot see. And that really is the problem we are trying to solve with Solve.Care. So let me walk you through it very quickly. I started in healthcare in 1991, stumbled into it, never let go of it. Over the years, I've had the privilege of working with President Bush's Health Savings Account initiative and then President Obama's Medicaid expansion and exchange initiatives. And over the years, served as a CIO of a major Blue Cross in the US, and also built several healthcare IT companies. And throughout that journey, it's always been clear that we tend to disintermediate the patient and the provider from our processes. They tend to be on the tail end of receiving end of our processes, and that really is a problem that has never really gone away. So about 2 years ago, my little one got sick, and despite my Rolodex of CEOs of every major healthcare organization in the US, it became a full-time challenge for us. So I got to question my fancy databases and big data centers and huge IT budgets and realized that a 3-year-old can basically upend the entire system. Got into blockchain not because we were looking for blockchain solution, but rather I was looking for a solution to a problem. And the problem that we're trying to solve here is, how do I delegate the authority to the patient so they can see whichever doctor they want and still enforce my rates and my contracts so that I don't get overcharged and overbilled? So how do I fix the access problem without losing control over the cost and utilization? So we are, in effect, building and have built a healthcare payment and administration platform that solves the two fundamental issues, which is how do I give the patient more authority without losing control, and how do I make sure the provider gets paid the right amount of money at the right time without going through a huge administrative burden. So that's what we are after. Not sexy at all, but it's really important. Because if you just take the example of US, we spend about 12% of our $3.5 trillion a year spend on administration. So that's $400 billion to $500 billion a year we spend making sure you don't get care. And that's just silly, right? I mean, we are actually spending that much money on managing the process of care, not delivering care. And the irony is the insurance company doesn't really want to spend that money, but they have to. So one of the CEOs of a major insurance company I was talking to recently, a colleague of mine said, we used to be facilitators of care. We became policemen of care. When did that happen? Well, it happened over the last 30 years. And it happened because systems are highly centralized. Processes are all driven to manage utilization, not really facilitate access. And we really need to change that. And most insurance companies execs in my former chair agree with that. So that's what we're after. So we are building a platform that addresses two fundamental issues. How do I give the patient the authority to go see any physician they want to see? And that you do through a distributed ledger that allows them to transport their benefits with them to anybody who is in network or out of network. And then how do I make sure that the provider gets paid the right amount immediately through the token that evaluates the care immediately and establishes a redemption value? In other words, how much is the doctor going to get paid? That's our vision for this platform. It's based on a care wallet that every stakeholder is issued by the insurance company, by the employer, by the hospital network, by the physician group themselves, and that allows the patient to make direct appointments with the physician. And in doing so, exchanges an eligibility token that tells me, as a physician, how much I'm going to get paid if I treat you. And so that's the core objective. And I get paid in care coins, which is the currency of the issuer. So at a very fundamental level, the Care Wallet is a distributed platform, is a platform for distributed healthcare apps. So if I'm an insurance company in the US, I can issue my enrollment card, my eligibility card in your wallet. And if I am a hospital network in India, I can issue my schedule in your wallet. So it is a platform for anyone and anywhere in the world to publish a healthcare distributed app inside the context of healthcare relationships. Underneath the wallet is a care protocol that allows me to shake hands between any two entities, patient-provider, patient-insurer, provider-insurer, employer-employee, so I can actually transact safely all the healthcare information. Now, what we are not, we're not a clinical record on blockchain. We don't touch medical data. We're not about storing electronic medical records or clinical information on the chain. That's somebody else's mission and challenge. Our goal is to facilitate access to care, scheduling, eligibility, pre-authorization, referral, billing, adjudication, payment. We're after the plumbing of healthcare in every continent, in every country. That is a major spend today. So that being said, this is a video. I'm going to actually skip that in the interest of time. Here are the types of functions that we are automating or decentralizing. Now, it's really important to note that we couldn't do what we are trying to do today without something like a blockchain. We couldn't say, well, let's go ahead and just do this solution. I've tried to build solutions like this for governments and commercial insurers alike, and there is no way to do what we're trying to do through a centralized database. You do have to be able to delegate authority and trust to the individual who's carrying your token, and that token has to be completely transportable between people we know and people we don't know. In other words, you may be a doctor that I have never heard of before, but if you accept that token, my patient should be able to come see you, and you are guaranteed redemption from us. But in doing so, your credentials must be verified. So there is a bilateral exchange of trust that must occur, and I don't want to be in the middle of it. So I left my comfortable corporate perch to start this company because I felt that blockchain would actually give us, for the very first time, delegation of authority that healthcare has desperately wanted and needed, but has never been able to accomplish it. So we are a ground-up solution from built on blockchain, and that's why I'm here, because I think blockchain really represents, or healthcare represents, a fantastic use case when applied properly. So here are the transactions that we typically want to decentralize. Eligibility, which is essentially defining your plan benefits. How many doctor's visits can you have? Can you go to the chiropractor every 3 weeks or every 6 weeks? And how much will I pay if you go to see a chiropractor that's not in my network? And so on. There is a function of scheduling appointments, one of the most cumbersome functions of a patient trying to find a doctor who will see him and will see them on the day they want to be seen. Then there is a question about doing pre-authorization and referral. How much permission do I have to give you before you can consume the healthcare? Do you need pre-authorization to see the doctor? Do you need a pre-authorization to see a specialist? We can decentralize most of this bureaucracy that essentially costs a tremendous amount of money. Now, you might ask, is this only a US use case? It isn't. In the UK, you have a growing incidence of self-pay model. You have scenarios like long-term care. In China, you have an issue of highly regionalized provider networks that are very limiting in access of care. In India, you have a massive population that's uninsured. These are all use cases that we want to address through a platform using localized distributed apps. Obviously, one of the most important functions of this is billing. Today, there are 2.1 billion medical claims generated each year in the US alone. Process that, 2.1 billion medical claims. Each claim on average is $35 and up. The cost of adjudicating that claim or verifying the claim is accurate sometimes is greater than the amount of the bill itself. That's ridiculous, but that's the way it works. So if we can eliminate 90% of those claims by making sure that they're real-time adjudicated at the point of sale, we can eliminate hundreds of billions of dollars in fixed costs that insurance companies have today, or hospitals have today. There is another element to this, which is the quality measurement piece. How do I incentivize the provider to treat the patient well, not just treat them, but to treat them well? So there is a question of pay for performance, which can be also transacted as part of the token exchange. So long story short, there are far too many use cases to explain in a day, let alone in 10 minutes. But those use cases vary country to country, system to system, but they are fundamentally the same. Access, utilization, payment, and quality, right? Those fundamental factors of healthcare don't change whether you're in Singapore or in San Diego. So that's what we are after. Having said that, there are two types of tokens we have built which are really innovative. One is a stable value payment token issued by my client, the old Pradeep in an insurance seat, that's backed by my reserves as an insurance company. That is a payment token that is transacted between patient and provider. It has zero speculative value. It is purely an intelligent payment currency. And it is fueled by the second token, which works in tandem, which is our Care Administration Network token. That is a freely traded token. So the idea is that as hundreds of billions of dollars of payments flow through CareCoin, because it streamlines the payment process, you need that many more platform tokens to transact. It's the gas for the platform that moves in sync with the payment coin. But the payment coin itself is non-speculative. When the provider gets a coin, they are guaranteed a fixed redemption. There is no risk in that coin being less or more day after tomorrow. So that's our mission, is to really create this dual economy where the payer, the insurance company, the provider, the physician are guaranteed a stable transaction on a highly automated basis, in a highly decentralized basis, but we can have an economy around it that can actually generate interest from people who want to publish distributed apps. Why would you publish a distributed app on our platform? Because your app generates CAN tokens. And those CAN tokens go up in value as the demand grows. So you may publish a formulary card that advises me of potential dangerous drug interaction between two drugs I'm taking. And if I'm paying you 1 CAN token a month for that card, well, then that's your revenue. And as millions of people adopt that card, then you have millions of cans in revenue coming to you. So we are essentially a framework on which we ourselves are publishing the administrative cards, but we see a community worldwide publishing clinical and non-clinical cards as well. Okay, last second, and I'll wrap up. I won't finish the deck because I think you've heard enough. We have signed a major insurance and care administration network in the US. We are launching our platform in live production for 5,000 plus physicians to receive payments in care coins starting June. It launches in May and then goes live in June. Following that phase, 300,000 plus families will get care wallets to do provider scheduling. So we are well past the MVP. We are actually going live with a tremendous amount of footprint. And that's just a single state, and then we have a follow-on 15 more states to implement. So this is a significant launch of a healthcare payment currency that will be in use live in the United States for paying providers by the insurers. The client will pay us in CAN tokens, which is the token that we are actually offering in our sale. I'm going to skip past this. You can find this on our website. A little bit about the company. It's about a 50% strong company, has been around for about 18 months now, and is a combination of an acquisition I did in last year as well as organic growth. So we are well on our way to really realizing the dream of using blockchain to actually impact access to care and accuracy of care payments. If you have any questions, please come by and see me. I'll be here for a few more hours, and I hope you have a fantastic rest of the day. Thank you.